On this episode of Putting Possibility into Practice, we're talking cloud versus hosted, the technologies and the services behind each and what customers are responsible for at their practices in regards to one approach over another. We're joined by Chief Information Security Officer Larry Whiteside of Greenway Health once again as we talk cloud versus hosted next on this episode of Putting Possibility into Practice, and it starts right now. And I'm Joe Augustinelli, Social Media Manager at Greenway Health. And as I mentioned, I welcome Larry Whiteside Jr. Larry's the Chief Information Security Officer here at Greenway Health, a frequent guest on our podcast. We just had you on a couple episodes ago as we were talking about data security, and we mentioned that our next topic we'd be getting together to discuss would be cloud versus hosted, and that's what we're talking about today. So I appreciate you coming back on the podcast on such quick notice.
No problem. Thanks for having me. I enjoy doing this.
So let's talk hosted first. And when we talk about cloud versus hosted, and we were just talking a little bit before we started the recording here. I mean, hosted is basically like, my Wi-Fi and my internet, at home. It's I'm responsible for everything on it. So in a medical practice, our approach, Greenway's approach, is cloud versus hosted. If it's on-site at the customer's location, what is a customer responsible for?
Yeah, so when they host it themselves or have it on premise, you'll hear that term as well. There are a number of things that they are responsible for that we actually do for them in the cloud. And unfortunately, in the conversations I've had with a number of our customers, they haven't really thought about a number of the things that they need to be doing right. So one of the things that they tend to do and they tend to understand is backups. And so they're backing up the data, backing up the server. The challenge often becomes they don't test those backups very often. So in the event that they do have an issue, an incident, whether it be a cyber incident or another technology incident, they aren't doing the routine practicing of ensuring that they can recover from backup. So they may have been backing up for 2 years without ever actually attempting to recover it, and then they get in a scenario where they need it and they can't do it. So data backups is one aspect of it. The other is just software patching across the board. It's not just patching of the Greenway software itself, but it's also the patching of all of the other ancillary software, that the operating system that the server is running on, all of the components associated with it, whether it be antivirus, whether it be local firewall on the system, whether it be other web-based things like Adobe and Java that need to be patched as part of the web components on the server. They don't tend to stay on top of those things, and they end up getting 1, 2, 3 or more revs behind, and that leads to opening them up for risk on that server.
And when we talk about cloud, I think the main concern that most people have in the cloud, and even when people think of the word cloud, they're thinking of, their cell phone and, maybe putting their MP3s and their data in the cloud. And their primary concern is typically security. Obviously, in the healthcare industry, it's much more complex than just MP3s or phone contacts. But when we talk about cloud, what type of information are we talking about, and what are we talking about into what Greenway is responsible for? Yeah,
a part of the reason that people have been so against or fearful of moving into the cloud was really about a lack of transparency around security and security controls. They knew, and from their perspective, the cloud was this nebulous environment that they were going to put their data, and because it was not within their control, they felt that any and everybody would be able to have access to it. And the reality is the cloud gives the capability to put a lot of controls around it. And if an organization is transparent, like we are choosing to do, we can state and talk about the different types of security controls we have in that environment. And reality is, because we do this on such a larger scale, we have the capability to do it much more efficiently and more cost effective than a customer can do it for themselves.
And let's talk about some of the technologies behind cloud technology, if you will. Software security, software patching. Talk a little bit about those.
So software patching, right? really is on us. If it's in the cloud versus on-premise. So on-premise, the customer has to make sure that they're staying up to date on the latest software for everything that they're running. Not just the Greenway platform, but the operating system and all of those other ancillary tools. When it's in the cloud, that's Greenway's responsibility. We have policies in place and procedures to ensure that we're patching critical, high, and medium, and low vulnerabilities on a regular routine basis. For example, Microsoft has a monthly patch cycle where every Tuesday they release patches. Well, we actually deploy those patches on the Saturday after Microsoft releases them. So we've got a much shorter window than most customers are going to have as it relates to the time it takes to test and deploy those patches to operating environments. And when we do this, we do it in a way where it's less impactful for the client, where they're not having to take large amounts of downtime or they're not having to come in during after hours. We do it during hours where customers are not going to be impacted based on their operating.
And then when we talk about next generation antivirus, I mean, are we talking, when somebody says antivirus, I'm thinking of Symantec, Norton, your basic antivirus software that's out there for personal PCs. What are we talking about when we're talking about next generation antivirus?
Yeah, so the typical antivirus that your normal everyday consumer purchases uses a list approach where they basically look at actions of malware and then check it against a known list of bad actions or known malware that exists out there. The challenge and problem with that is if it's an unknown malware that hasn't made it to the list of their particular antivirus solution, it's not going to catch it and it's not going to stop it. So what the next gen antivirus solutions do is they actually focus less on applying a list type approach. They focus more on the activity of what's going on based on the content and context. So they're looking at actions, they're looking at traffic coming in, they're looking at actions that services and different components of the operating system are performing to identify, is that in line with the way that that service or executable should run on this operating system. And when it's out of line of that, they have the capability to then stop or sandbox those things to ensure that it doesn't take advantage of the system.
And some of the other technologies included with the cloud, we talked about security, we talked about antivirus. Now let's talk about the incident. Let's talk about detection and response.
Yeah, so detection and response, both from a technology and a process standpoint, are important. And most practices have not gotten to the level of maturity where they have an EDR tool, which is called Endpoint Detection and Response Tool, nor do they have incident response policies, processes, and procedures so that when they have an incident, they know what to do, they know who to call, and they know how to operate. From a Greenway standpoint, that's part of our job. I've got a team that's dedicated to these types of things, and we deploy these EDR tools because what they give us is the capability to isolate threats. So if we identify a threat on any one of our particular hosted environments, we can isolate it to the server that we found the threat on so that it doesn't impact anything else. In a practice, without them having the ability to isolate, it goes from the one server where the event may have happened to every other server in their environment. So, for instance, if they have multiple Windows servers, even if the EHR server is sitting somewhere else, and they have an event on one server, because they don't have the ability to isolate it, it could end up impacting the EDR server. the EHR server at some point. So having the technology in place to isolate systems is extremely important. Secondly, the incident response process. The incident response process is something that must be tested on a routine basis because your ability to respond to attacks in a timely manner and not just isolate them either via technology or manually by disconnecting the servers, but also understanding who to contact. What providers do you contact? When do you contact the FBI? What law enforcement do you get involved? When do you get an incident response team to come in and do forensics? All of those things are an important aspect of understanding how to respond to an incident. And most practices don't have the time nor the resources to focus on those things. At Greenway, I've got a team, and we do that. We've got we have contracts with outside entities for incident response, so that if we have an incident and we need a team to respond, they're here and they're on site within a 24 to 48 hour notice. So for us, that adds a lot of value to what we're providing our customers.
And one other type of recovery we didn't touch on there is, with our location and a lot of the locations of our customers is disaster recovery. And especially over these last couple of years, we've seen stronger storms in areas where many of our customers are located. So how does recovery work after a natural disaster, be it a hurricane or a storm of a similar magnitude?
Very good question. And if you think about it, for most of our customers, their practices are in typical office buildings or office parks. Those places are not designed to withstand natural disasters. They are built to house people, and they're built for people to run businesses out of. But that's pretty much it. So they tend to be very, very heavily impacted during storms and things of that nature, where our hosted environment is purposely built to withstand a number of things, to include earthquakes, natural disasters, things like that, because they have dual power feeds. So that if there's a down, and sometimes more, if there's a power outage in one area, we've got other power from another provider to ensure that we've got uptime. We've got cooling. There's physical security components. In some instances, data centers are partially buried underground. So there's a whole lot of things that tend to not impact a typical data center that's built for these types of hosted environments versus one of our customers' regular office areas.
And talk a little bit about, and you mentioned this with the different teams you have in place here, the 24/7 monitoring.
Yeah, so 24/7 monitoring is another aspect of, most practices probably aren't shutting down their computer systems at night when they go home. They aren't turning them off. They're leaving them connected to the internet. But when they leave, there's nobody actively looking at it. And in reality, for the most part, even when they're in there having patient visits, there's nobody actively looking at network traffic and looking at different threats that are potentially impacting their systems. At Greenway, we have contracted with a third-party entity to provide 24/7 monitoring in accordance with my security operations function. So I've got a team of people in security operations that do monitoring during the daytime. And then what picks up is during the 24/7, 365, we partner with a third-party entity that gives us that additional set of eyes, where they've got a team of people who are also monitoring, so that when my team is down, when we're on the holidays, when we're on vacation or whatever the case may be, we've still got coverage. We've still got somebody who is looking at and monitoring every system across our customers' environments that's in our hosted environments for threats.
And we did touch on this on a recent episode, but since it's part of the cloud, we can certainly discuss it again and bring it back up to the forefront. But talk about cyber liability insurance.
Yeah, cyber liability insurance is one of those things that's still growing. It hasn't been mandated yet. Right now, customers who have it are either being asked to do it because they're part of an exchange, or their insurers are asking them to do it based on the risk that's in healthcare right now. But it hasn't been something that's been mandated by HIPAA or ONC yet. But from our standpoint at Greenway, we recognize the value of the data that we hold for our customers. Right? We do know it's the customer's data and it's their patient data, but at the end of the day, we're custodians of that data, and we've got a responsibility and liability to them. So we have cyber liability insurance coverage to ensure that in the event of an incident that impacts their downtime, we've got a way to ensure that they can recoup some aspect of the cost associated with being down during that time. We recognize that there's an impact. We do everything we can to prevent breaches, but at the end of the day, it's sort of like car insurance. Nobody plans to get in an accident, but you have insurance just in case. That's how it is for us with cyber liability insurance. We don't plan to have a breach, but in the event we do, we want to ensure that we and our customers are covered.
Great. Well, thank you for taking the time today to go through cloud versus hosted for our customers and for our podcast.
No problem. Thanks for having me.
That was Larry Whiteside Jr., the Chief Information Security Officer here at Greenway Health, as we talk about cloud versus hosted. And for more information, you can certainly visit our website at www.greenwayhealth.com. I thank you for listening to this episode of Putting Possibility into Practice. I hope that you enjoyed the episode, and if you did, you will subscribe to our podcast, and you can find us on a number of platforms, including the Apple iTunes Store, Google Podcasts, TuneIn, Stitcher, Spotify, SoundCloud, Libsyn, and look for more platforms coming soon. I thank you for listening to this episode of Putting Possibility into Practice, the podcast from Greenway Health. I'm Joe Augustinelli, the Social Media Manager at Greenway Health.